Hi guys, today I'm here with another interesting video on open bite. So in this video, let's discuss on the definition of open bite, the classification, the etiology of open bite, and also the ways to manage it. Without further delay, let's get started. So what you mean by open bite? As per definition, it refers to a malocclusion that occurs in vertical plane. And Moyer suggests the definition of open bite as localized absence of occlusion while the remaining teeth is still in occlusion. So moving on to which we have the classification based on its location as anterior open bite or posterior open bite, and also in accordance with the cause of it. It can be a simple dental or a simple kind of open bite, or it can be a complex or a skeletal kind of open bite. Moving on to which we have hereditary, in which it is occurring due to secondary class 3 malocclusions, and also the environmental factors can be the pressure habits, which includes the mouth breathing as well as the digit sucking, and also many iatrogenic causes is related to it, along with skeletal open bite. The skeletal open bite has to be a serious concern, has to be treated with surgical options too. So moving on to which, let's see how the diagnosis of an open bite can be established. So generally, it is through a case history, definitely, and also through extraoral as well as an intraoral examination. And to combine both two is confirmed using radiographs, especially the cephalogram, which gives us a clear cut on the state whether the open bite is mainly of a dental anomaly or a skeletal anomaly. So the treatment can be progressed with the diagnosis to further head onto with appliance therapy or a surgical orthodontical therapy. Moving on to which, let's see how the management is in a deciduous dentition as well as in a mixed dentition. So in mixed dentition, it's mainly caused while the patient is still having habits such as tongue thrusting, thumb sucking, and the habit control counseling and the psychological support as well as the habit interfering has to be done at this stage. And it also can improve the growth modulation uh, uh, that can be an advancement of the mandibular movement with various other removable or fixed appliance orthodontic therapies which we have. So the management at a deciduous level or a mixed dentition is much more easier than in a fully grown adult. So the dental management can be corrected using a fewer or a much more easier techniques like gaining the confidence of the patient, to educate him on her of his malocclusion and to treat it better. Then an implementation of certain techniques like the remainder therapy, like small removable appliances or applying of the restriction of the fingers, the reward therapy, the restriction therapies which has been commonly used, and also the small scale employment of the removable appliance such as the vestibular screen or the tongue crib can be very reinforcing appliances that can be dealt in a deciduous dentition or a mixed dentition, to educate the patient more or to restrict this habit to progress further. So the malocclusion has been intercepted at an early stage, which limits the complications for the future. But whereas if it's the dental management concerned is through appliances, first we have the bluegrass appliance. So as in the figure is typically how a bluegrass appliance looks like. So you have a roller in which the tongue is being repositioned to touch the to touch the roller, and that's how the dental management is taking place. Moving on to which we have the high pull headgears, which has been currently used, which ensures the vertical position of the maxilla and interrupt the maxillary posterior teeth. So the headgears can be used up to 14 hours, in which it is worn during the night time preferably, and the force exerted could deliver up to 350 to 450 gram per side, and it has a drawback that it cannot control the eruption of other teeth. So high pull headgears can also be an important and effective method to control the setting in of malocclusion by applying the adequate pressure in areas, especially the maxilla or restrict the mandible or restrict the growth of maxilla that prevents the open bite scenario to set in. So these moving on to which we have the hypal headgears, the maxillary splint, which is being commonly employed. So there is this acrylic splint which is being attached to a face bow on the hypal headgear, and it substantially has the maxillary skeletal with a good dental effect and a good vertical control. Moving on to which we have the functional appliances with the bite blocks. That is, the headgear effect is also being used with functional appliance and posterior bite block. Next, moving on to which we have the high pull headgears, which is also augmented or accessorized, or it is used as an adjunct in other class 2 scenarios. The headgears basically controls the maxillary growth, allows the force to be adequately delivered, and it improves the retention appliances and produces the force direction, which is estimated in the resistance of the maxilla. So the surgical orthodontics is come into pictures when the following techniques doesn't work or the patient has passed the age of growth, especially if it's a fully grown adult or the patient is set in a phase of adult orthodontics. What we have to look at right now would be a more surgical option. So the surgical orthodontics is generally termed to refers to a lot or a range of surgical procedures which can be used to correct the open bite scenarios, and it also helps in adjunct in conjunction with orthodontic treatment. So moving on to which, let's see what is orthodontic surgery, in which a surgical procedure with the orthodontic therapy is used to is used to correct the dentofacial deformities or severe orofacial disproportions of both maxilla and mandible, or in combination with both. So the common surgeries which is being employed will be maxillary surgery or Lefort 1 down fracture of maxilla, and also the segmental maxillary osteotomy, and a combination of both is used in correcting the surgical open bite in adult patients. So moving on to which, let's see what is mandibular surgery options. So the BSSO, that is bilateral sagittal split osteotomy, is definitely being used in a mandibular osteotomy, and inverted L osteotomy of ramus uh, um, uh, which is reinforced, is also used under mandibular surgery, and also the superior repositioning of the chin by a mandibular lower border osteotomy is also preferred under the surgical management. So moving on to which the anterior open bite, which is not related to a longer phase, can be intercepted by two major possibilities. So the surgical options that is mainly conserved that is concerned are Lefort 1 osteotomy, which is much more simpler with anterior or posterior components, and maxillary anterior segment of osteotomy, which is also have a setback. If it's a repositioning of the maxilla, it has got a setback, or the mandibular setback to correct the open bite is mainly preferred. So the other anterior open bite management is the eruption of mandibular incisor and excessive eruption of the posterior teeth, the anterior subapical osteotomy, which is again preferred. So you can see the dotted lines in which it refers for the various kinds of osteotomies that is generally uh, seen for the surgical orthodontics. So you have the Lefort 1 level, which is at the base of maxilla, then Lefort 2, which is moving on to the supramaxillary area, and Lefort 3 obviously including the orbit. So that is how you have correct an anterior open bite surgically. Posterior open bite would have the same techniques which has also been applied to the mandibular teeth, especially when there is a mandible prognatism. It is basically the setback of the mandible surgically. So the open bite is a scenario in which it can be dentally or located or skeletally. The dental treatment is, however, very simple and can be intercepted in a growing child. So, interceptive orthodontics, like controlling the pressure habits or developing a good dentition all throughout the while, can reduce the possibility to carry it over. And the complication of an open bite can be treated very well then compared at the later stage. So, fully to correct open bite in a fully adult patient, it requires surgical, with the help of surgical orthodontics as well as the fixed or combination of both. So both kind of treatment approaches has to be considered initially and treated first. So surgical orthodontics is generally concerned if the skeletal discrepancies is more than manageable with the dental or any other fixed appliance therapy. So here we conclude the treatment options of open bite and the various classification etiology. And this is again moving forward with a little detail of it can be looked on for the surgical orthodontics video. Thank you.